to BOPO Run. In this week's video, we are going to be talking about peeing while you run and why that might happen. With us today, we have a guest speaker, Lisa. She is a physio, and one of the conditions that she treats is pelvic floor conditions. Lisa, if you want to describe a little bit about what that means, and then we have some questions that will hopefully teach us more about it.
All right. Well, thank you, Annie, for inviting me today. So yes, I am a pelvic health physiotherapist. I'm also a orthopedic physiotherapist. So really the orthopedics, anything like muscle, joint, nerve related. And pelvic health physiotherapy is a specialization, but again, that's also connected because our pelvic floor is the same. There's bones, ligaments, muscles, and nerves, and all those type of tissues as well. It's just we don't get to see all of those like with our eye, right? Because they're internal. So yeah, that's the type of work I do. And peeing while you run is part of an incontinence issue and the pelvic floor. And the pelvic floor really is anything that actually starts from the abdominals to the hips and the lower spine, so the lumbar spine, and then all the muscles that are internal as well. Yeah.
Well, I literally always only thought about pelvic floor as like your pelvis.
Yeah, yeah, and I think that's more common too. And I remember before thinking that's all it was, but just anatomy-wise, there's a lot of things that connect to the hip bones and pelvic bones. A lot of the muscles overlap, and they also create that movement as well. So that's why when it's pelvic, we start pretty much like anywhere, yeah, from like the abdominals to the hips, really. Yeah.
Amazing. Cool. Well, I know, yeah, one really common thing that a lot of people I know who are runners is urinating on a run. And I just kind of wanted to talk a bit about that one because it's something I hear about often, and I know it could be a little bit embarrassing. So I just want people to know it happens. And I just wanted to know what can be some of the reasons for this, and is it always a pelvic floor, like is it always due to having a weak pelvic floor, or are there other factors at play?
Yeah, that is a good question. So it is a common issue. And the reason why in running, one of the reasons why people may leak is because what we call this type of incontinence is stress incontinence. And so what that is there's that involuntary loss of urine, so that leakage. And that's because there's pressure that's placed on top of the bladder.
Okay.
And so when there's pressure on the bladder, that creates then that pressure towards the pelvic floor muscles to have to take on more of that strength and ability to hold up. And so often, yes, it is because there is a weakness in the muscles. But it's also sometimes related to a timing issue. So almost like a reflex response as well. Yeah.
Oh, interesting.
So yeah, I'll show you quickly just because I know it's a topic and you're like, wait, our bladder and then this and this. And so I have a model.
Yeah. Oh,
yeah. So this is our pelvis.
Oh, cool.
Yeah. And so these are like the top of those hip bones that we feel, and this is the pubic bone. And then when you look kind of inside, so this is like a top down view. These are the deeper muscles, if you can see that.
Yeah.
And you'll see that the muscles attach from like the front of the pubic bone all the way to the back of the tailbone.
Oh, wow.
And then there's also muscles that go side to side between like the two sit bones, like your butt bones. And there's layers. So essentially, just as a visualization, you could think of it as like a hammock, right? And then if you have like your bladder, the bladder rests on top of those muscles. And so when there's pressure from running, and that pressure can be anything from like running, coughing, sneezing, jumping, that pressure comes from what we call intra-abdominal pressure. And so what happens is something like, let's say we're holding our breath, that creates pressure within the abdominals. And then that pressure gets pushed down.
Yeah.
And that pressure then pushes on the bladder, and then that bladder pushes down on those muscles. So now, if those hammock muscles can't support holding the bladder, then there can be some of that leakage.
Interesting.
Yeah. And so also the other thing, what I was talking about is like a timing, almost like a timing coordination issue. What happens, which is pretty cool, when there's a change in force. So let's go back to running, like that impact creates a lot of like pressure into our system. When there's that force, what happens is the muscles will, under normal conditions, reflexively contract, right? So if I'm gonna pretend
Yeah.
this is we'll call this the urethra, okay? Yeah. That's where the urine actually comes out. So reflexively, the muscles will contract, so it constricts, and so now the urine stays within the bladder. And it's a timing issue, and it's like within milliseconds. But if that timing issue is off, those muscles don't contract, so they don't close that off, and then boom, we get leakage. So
Wow. I have so many questions about that, but I feel like we're
I
gonna.
know it's like a huge topic on its own.
Yeah. No, I
Like,
feel.
yeah.
Yeah.
So that's just a quick. Yeah, there's so much to it.
That's incredible though.
Yeah. So those are two things. It's just, yeah, it could be a weakness where the muscles just can't support the bladder, and so it's time to support the bladder, and then it doesn't close off,
Right.
and so there's leakage, like it doesn't constrict the urethra, and so you get leakage coming out, or it's a timing issue that and so those muscles then aren't closing off in time, like a preparatory, so reflexively contract, and then it holds the urine in. So if that timing's off by any little bit, you can experience leakage. Yeah.
And are there other things other than urinating or leakage, sorry, that indicate having a pelvic floor dysfunction?
Yeah, there's so many,
Oh, no.
so many conditions out there.
Okay.
So what I would say is I kind of will categorize it because there's so many conditions like under each category. So one category could be the incontinence. So any leakage, like involuntary leakage of urine. There's also with our bowels the same, like so fecal leakage. There's also issues with like urge and frequency. So people may leak with this as well, but they might find like, okay, all of a sudden they're sitting there and all of a sudden they have this sensation like, I gotta go to the washroom, right? And it feels like I can't hold it in. They gotta like run to the washroom door. Or frequency is just like, okay, wait, I just went, a few minutes ago, or I just went like 10 minutes ago, and now I have the sensation that I have to go again. So that urge. So that's typically due to other reasons. But usually, yeah, it's that frequency and quick sensation like, oh my gosh, I have to go. I'm not going to make it. And sometimes, yeah, people will not experience any leakage, but sometimes they will.
Right.
And just to make it more confusing, some people, you can actually have both. You can have both like stress and urge incontinence.
Okay.
Yeah. So that's one. And then another like other dysfunctions that people can experience is anything to do with like sexual pain, right? So pain with sex, pain with orgasm, pain sorry, but even before or during sex, same with orgasm, before, during, and after.
Mhm.
Um, there can be a lot of sensitivity to um, the sex organs themselves. So um, a lot of the tissue surrounding there can be very painful, and that's for different reasons as
Mhm.
well. So there's that category. Um, and then there's also another category of just anything like pelvic pain related, right? So anything of like, hey, I have some abdominal pain. It feels like pain down below, right? So even like in this pubic area, whether it's more external or internal. Sometimes, yeah, like when I was talking about the hips, sometimes even like hip, low back, sacral, tailbone area can have issues there,
Right.
and pain. And so that's also some other types of conditions that are related to like pelvic floor. Um,
There's
yeah.
so many things I didn't know about.
Yeah, there's so many. I know. Even I, before I got into the specialization, when I started learning, like I didn't realize there's so many things that could happen that could be a problem.
Yeah.
Right? Yeah, there's a
Wow.
lot. So
Amazing.
yeah.
And if someone isn't experiencing any kind of pelvic floor dysfunction, like even as you were speaking, I was like, I feel like there's some of these things where I'm like, do I have pelvic floor
Yeah, no,
dysfunction?
yeah,
So
yeah.
now that I am asking this question, I'm like, does does anyone not experience these things? But anyways, anyone that doesn't experience any of these kind of symptoms or anything like that, can running increase your risk of developing a pelvic floor dysfunction?
Yeah, I would say for the most part, no.
Okay.
Right. So I think like any other exercise or activity you pick up, if you um, seem fairly healthy, like you should be fine. Also, it's with running. I
Mhm.
enjoy running. I think there's nothing wrong with it, but you do need to have like there's quite a bit to it though, right? You do need to have some strength in your muscles, some like stability throughout, and a decent amount of endurance to even begin with, and certain amount of mobility. So would say no because I look at it as well. If I feel like you could develop an ankle sprain while you run, right? But that shouldn't prevent you from not even starting. So
Yeah.
for the most part, I would say no.
Okay.
Yeah, yeah,
Yeah. Okay. That makes sense.
yeah,
And so, say someone isn't experiencing any of the symptoms of pelvic floor dysfunction. Are there things that we can do to lower our risks of experiencing this?
yeah, yeah. Um, I'm gonna mention this, and I'll go into that question actually a
Yeah.
little more because I think it's a bit tied in. So, what's interesting too is people who have like low back pain or
Mhm.
back pain, or but more in the sense of a chronic back pain. Um, there's studies that show, especially in more so in females, that if they have chronic low back pain, they have a high percentage of also developing issues with their pelvic floor. So pelvic floor dysfunction, even incontinence, there's a big link between the two. So my suggestion is like, yeah, if you're having any issues of like in the body, like your low back issues or kind of that low back where just above the tailbone or your tailbone area or in the hips, um, have that addressed because there's so much overlap as well
Right.
with pelvic floor, pelvic health.
Mhm.
So address those. But I would also think, yeah, if you're having those issues, like you want to address that too, just for running, right? Like your back's gonna hurt and your hips are gonna hurt if it already hurts, and then you start running, right?
Yeah.
Um, so yeah, that. And then you asked, oh, what other things to prevent some risks of.
Yeah. Like, are we able to, on our own, do preventative, I guess, strength exercises as
Yeah,
well?
I think in general, just keeping your body mobile, and the muscles and joints strong. That's good no matter what, whether you're running, but just in general in life to prevent
Yeah.
injury and other diseases as well. Um, but what is a little bit more connected to, I would think, is there's how we breathe is a big component. And that is also part of, yeah, the intra-abdominal pressure that I was talking about. So for people who tend to find themselves like when they're exercising, that they're holding their breath a lot, right?
Yeah.
That's not good because we want to have that continuous flow when we breathe.
Mhm.
Um, and that like that's another whole topic too, that I could get into as well. But essentially, you just want to think like, yeah, when we take a breath in, our that pressure now increases. But we want to make sure that as we exhale, that we are exhaling and allowing for that breath to flow out. And it's for the easy way I'm going to say is it's continuous, right? So if we hold our breath, that's not good, especially when we have to now exert um, more load and weight. So, for example, like if we're weightlifting, right?
Yeah.
Um, I would say for the most part, unless you're an Olympic weightlifter, you pretty much want to think that when you are exerting um, the harder part or you're exerting weight, that you want to be breathing out and not holding your breath. And I think that's something that quite a few people do is like, like I'm lifting weight and it's like, I'm holding my breath and I'm pushing it up. We
Yeah.
don't want to be doing that. We want to be actually exhaling through it. So if I'm lifting heavy weight, I want to be like, right? So I want to be breathing out. Um, because if I hold my breath, that creates strain and that creates greater pressure onto those organs, such as your bladder.
Right.
And then that ties into the potential of incontinence, amongst other dysfunctions too, but that's one of them.
Yeah.
Um, the tip I would say, and there's this like saying out there is that's helpful is like you're gonna blow when you go, right? So when we're lifting weights or even anything that feels a little more difficult, doesn't actually have to be weight in our hand. But for example, let's say we're doing a bridge. For a
Mhm.
lot of people, it'd be more helpful once they lift their hips up, they breathe out. So
Right.
yeah, I pretty much tell people like think of it as like the harder part of the exercise. That's when you're gonna be like doing a slower exhale and you're not
Right.
gonna be holding your breath, right?
Right.
The other thing too where people tend to strain is um, with like their bowel movements, right? Constipation's common thing now with people for various reasons. And so that straining, that like forcing to push, that too can also create a lot of um, problems with the pelvic floor muscles and organs. So I do a lot of education too with people with who are experiencing constipation of how to breathe, how to position themselves,
Mhm.
um, because again, that pressure and force is just not helpful to the tissues.
Yeah.
Yeah, and speaking of that too, I'll mention something I realized. You asked me about what are some pelvic floor conditions. I forgot to mention a common one too is prolapse.
Okay.
Um, just a brief thing about it. That's prolapse is anything where the organs, the pelvic organs, start to actually kind of like descend, right? So the we can have some descending of the bladder, the rectum, the uterus. And I got the main ones. Yeah. Okay. So Um, again, that just means now those strong muscles, those hammock muscles that are holding up one of the organs, so let's say our bladder, if they're not strong enough or taut enough, then they'll start to kind of go more like a saggy. And
Right.
so that sagging can then start to um, create a bit more pressure within us. And then as well, like prolapse is it another great topic too, but Prolapse. Sometimes a common thing is vaginally, you might start to see some tissue, and or you'll start to see some tissue in the vaginal canal, and it might look like there's something looks like it's coming out of me, or they might experience this sensation of like this heaviness and pressure when they're standing.
Right.
Um, so if you are experiencing things like that, like a prolapse, heaviness, bulging, you want to make sure you address that as well, because running is going to add a lot more to those tissues that aren't, let's say, strong enough to support. And even that can then lead into some incontinence issues as well.
Right.
Yeah.
Well,
So
there's so much.
there's so much. And that breathing and straining can also create greater problems with prolapse.
Wow.
So yeah, so there's
There's
so
so
much.
much more to it than I
Yeah, there's so much. That's why when I'm speaking, I'm like, wait, there's this and there's this and
yeah,
there's that, and there's a lot of overlap. Like if you have this, you want to make sure this is not happening. So, um, yeah, anything where you feel like something doesn't feel right, if you're having any pain in like the pelvic region, you want to address that before you start going into bigger, higher intensity exercises, right? But it doesn't mean you shouldn't do them, but you want to make sure, hey, what am I capable of at this moment? What can I do to prevent
mhm,
um, issues further? So
right.
yeah, so that was a lot, but
Yeah.
my
No, but
key
that's good.
ones are like breathe. The easiest one is like that we can control is like make sure you don't hold your breath and you don't strain, and breathing properly with it.
Yeah.
Um, is a big one. And another quick helpful tip too that you can do is um, especially um, like when we're like in public, usually like public toilets, people tend to usually kind of hover because they don't want to sit on the toilet seat because they're like, this is gross. There's like
Yeah.
urine on this and all that. But what happens too is when we hover, we're kind of in a mini squat, and reflexively, almost like automatically, those pelvic floor muscles are contracting. And when
Right.
it's time for us to urinate, those muscles should actually be relaxed.
Right.
So the key thing is like don't hover. Um, what to do. You got to wipe it, and studies show there's you don't it's rare to catch some infection, but yeah, even at home. I mean, if you're like, I don't know, maybe you do hover, I don't know, but that's a simple one
Yeah.
where it's like, oh, okay, now that I know that, that could be one less thing I do, so I'm
Yeah.
not stressing out my tissues. Yeah.
Yeah. That is so like I obviously like when you're growing up and you go to the washroom with your friends because like
Yeah.
girls go to the washroom together and
Yeah.
yeah, all of my friends would be like talking about hovering and I was like, I cannot pee. I cannot physically release my pee without sitting on the toilet. So
Yeah, I know. Okay, good. Now you know why. You're like, yeah,
yeah,
because those muscles technically, in the squatted position. I need to. They're contracting to a
yeah.
degree. Yeah, and so they're not able to kind of like relax and let go.
Okay.
So
Good
yeah,
to know.
yeah, I know. It's interesting. Yeah.
And then I guess we kind of touched a little bit on this
Mhm.
in the like how there's categories of how um, pelvic floor can be like pelvic floor dysfunction can be represented, I guess. But does it present differently between genders, or is there overlap between
Yeah.
the symptoms?
There's um there's overlap. Pretty
Yeah.
much internally we all have the same muscles. Like males have pelvic floors as well. I would say, I guess, externally more so the organs are different, but the muscles and tissues and ligaments and nerves is all the same.
Mhm.
um, but in males it is less common for them to experience incontinence, and that's just because of the length of the urethra. So the urethra is just, you could think of it as like the tube where our urine flows out from the bladder.
Mhm.
And so in um, females, right, so or vagina owners,
Yeah.
it's much shorter. It's um, 4 to 6 millimeters or centimeters.
Oh, wow.
Well, let me check. This doesn't make sense. Yeah, centimeters.
Yeah.
Millimeters doesn't make sense. Anyway, so that urethra is 4 to 6 centimeters, whereas in male, so like penis owners,
Yeah.
there's like 18 to 20. So if there is an issue, it's less, right? Um, so that's a little less common. And what I found interesting too is because the urethra is a bit shorter in females, it's a little more common for them to experience or develop urinary tract infections versus males. And then yeah, I was like, oh, okay, that's kind of why, because the length of like that bacteria that enters for it to go to,
Right.
ours is shorter, so it's a little more common.
Yeah.
And plus also just how close our urethra and our rectum is,
Right.
right? Versus males, like with the penis and their rectum, it's further out over and away. So there's that. But for the most part, we experience similar things. It just is presented differently, right? So same, like they can have sexual dysfunction and pain, but theirs might just be like, okay, I'm having erectile issues or pain within like even say the scrotum and testicles and the penis itself, whereas with vagina owners it might be like I have pain around the vulva or more internally. So really it's just the organs, but they can experience a lot of the same dysfunctions. Yeah.
Interesting.
Yeah.
Cool. And then I guess my last question, now that we've kind of gone over all the ways pelvic floor dysfunction can present and all the symptoms and things like that, can you speak a little bit about how you would treat a client?
Yes. So there's so much to it at times, depending what the condition is. But essentially, at the beginning, whether someone has issues, I'm going to keep it a little more general. So whether issues are more of like a strength issue, or they can even have issues where their muscles are very tight and not letting go, or which is also so much like they're contracting too much. One of the main things to start with is just education on breathing, because that makes a big difference. And a lot of us aren't breathing properly. And it seems so simple, but even little things like, when we're stressed or anxious, our breathing pattern changes, right? We become more of like a chest breather. Our breathing becomes more rapid and very shallow.
Yeah.
And so that does create a change in our breath, the diaphragm as well. So the diaphragm moves when we breathe, right?
Yeah.
It's the muscle that moves. And then that diaphragm also is part of our entire core and breathing pattern. I just realized that's a whole nother topic too. So I was kind of like, wait, there's so much to that too that's connected that that I could go on and talk about. But pretty much keeping it simple, breathing, it makes a difference. So if we're not breathing well, we're more shallow and rapid, that's going to create problems to the pelvic floor because there's a connection.
Okay.
Yeah. And also doing a lot of education, right? So lots of education too at the beginning with patients, just so they understand like, hey, what is going on and possible reasons why this is happening. Some are pretty clear, some aren't always so clear, but and because this is such a topic and area that can be also very sensitive for a lot of people, right? There's so much taboo, there's less discussion about it. Even that education component being like, hey, this is a thing, this is not just you, like that puts a lot of empowerment back to the patient and feeling like, okay, it's not that weird, it's not just me, and hey, there are things that can be done to assist with it. So those are the two things that pretty much I do with everyone.
Mhm.
And then, yeah, depending on what the condition is. So if there's some strength issues, working on strengthening. And it's really no different than training other weak muscles, right? So testing them out. How much strength do you have at this point in time? What are your goals? And then we work from there. Do we need to build endurance? Do we need to just actually build strength for like kind of tone stiffness? Do we need to work on some timing? So things like that. Or if there is a lot of tightness in the pelvic floor muscles, working on things like, okay, releasing those muscles, right? And there's different techniques that can be done as well. And a lot of this too is like I do it with them, but tons of homework, tons of stuff to do at home
Yeah.
too, right? Um, that and then working on those components and then just building it back up to what it is that they want to what their goal is.
Mhm.
So kind of just building up a treatment and training program that way. um, so those are some things. And then as well as if people are experiencing um, I guess let's say like emotional or cognitive issues, right? Kind of the common like stress, anxiety, depression.
Mhm.
There's a big link to our pelvic tissues as well. Yeah. So like a common one is like if we're stressed and anxious, our muscles will tighten up, right? Just as much as like these like upper traps will get tighter or low back will feel kind of tight. A lot of pelvic floor muscles will tighten up as well.
Yeah.
So working on um, different techniques out there that can be done um, just to help allow the mind and the body to kind of go back into a more like balanced resting state
Yeah.
as well. So whether it's like meditation or mindfulness or like a gentle yoga or our breathing, going into that just to calm down really our nervous system. So when our nervous system's ramped up during stress, anxiety, our tissues get ramped up, our pain gets ramped up. So going like providing tools that they can use
Yeah.
on that. Also pain education, what is happening.
Yeah.
So those things are part of what we do as well. um, I'd say those are the main ones. Yeah, there's a few other things here and there, but I'd say those are the key ones.
Yeah.
Yeah, that we do.
Wow.
Yeah.
This, I've learned literally so much.
Yeah, yeah,
Um,
good, good. I know
yeah,
there's a
but
lot.
yeah, I feel like after speaking to you, I'm like, why didn't why didn't we have a physiotherapist come into my elementary school when we were doing sex ed? Like, there's so many things that like
I know
I'm
that.
like,
Yeah,
wow.
there's so much I've learned too.
Yeah.
Like when I ended up doing these courses in specialization, and then I was like, I didn't really know this, and I'm in health, so I would think I'd be a little bit more exposed, but I was like, I didn't know these issues exist. Yeah, so I'm finding now too that there is more awareness coming out, but it's definitely not as common because
Yeah.
when I was talking to my friends, they were like, what's like people don't even know like what is pelvic, like what is the pelvic, where is your pelvis, what is that? And then
Yeah.
pelvic floor, what's pelvic floor, like what is that, right? So even just that, those words,
Hmm.
I'd say for the most part, I think even now the average person's not sure what that is.
Yeah.
No, I know that for a fact because even last year when I was telling some patients stuff, they're like, what's pelvic floor, what is that, right? So
Yeah.
if that's not really known, a lot of those conditions aren't very well known yet, but there is more discussion coming out. There's more education coming out, but it exists and it's there and it's been around for years. But I think just getting that word out more.
Yeah.
is definitely going to be helpful. So
Yeah.
yeah.
Amazing. Well, thank you for joining me to chat
Yeah.
a bit about this. And I've learned so much, and hopefully our runners will also have learned so much.
I hope
I
so,
know
yeah.
you, sorry?
Yeah, no, I hope so. I hope it just gave them a little bit of like, oh, okay, so now this is why, or now this exists.
Yeah.
Yeah. Yeah.
Yeah. And I know you have an Instagram. It's physio.with.lisa, right?
Yes. Yeah.
And
Um,
I know you post a lot of educational stuff, so I'm going to make sure our runners know about it and can kind of follow along and learn. Because even just me looking through, I was like, wow, there's, I did not know these things. So it's
yeah,
amazing.
I know. And the Instagram account's a bit newer. I decided to finally do it. Yeah, and I'm just kind of using it as like some resources or awareness for people.
Yeah.
But there is a lot because I go over like the orthopedic physio stuff. I put some stuff about pelvic physiotherapy and then some stuff about yoga as well. But
Amazing.
I find that there is quite a bit. What's so nice is there's some overlap. So I love combining all of them at times when it's necessary.
Yeah.
Um, I do have an email sorry, I do have a website as well. And so there's a little bit more information there as
Mhm.
well. So if people wanted to look up, so it's a little bit of categorized under pelvic. I list some conditions um, that I treat as well. So that's just like a nice quick thing if people are wondering like, wait, what are some of the conditions? Because I don't even think I talked about I didn't mention all of them.
Yeah.
So there's a little bit of information, brief information there, as well as like through, I've put up some blogs. So
Oh, cool.
that can be a
Okay.
resource too.
Yeah, I will make sure that everything is, this is my first time saying this, so I'll make sure everything is linked below. um, so I'll have your website, your Instagram, and the blog posts that you mentioned. But yeah, this was
Yeah.
awesome.
Yeah. And if anyone had questions, they can, my email is connected to the website or um, on Instagram. This is my first time saying it. You can
Yeah,
like direct message me
yeah,
if anyone had questions and wanted to know more about what we talked about, or just in general, if they had other questions related. So they can message me there as well.
Thanks so much for joining, and I hope you all have a wonderful week and happy running.